Hello, and today we will be going over patient assessment vital signs. Why are vital signs important in patient assessment and clinical practice? Vital signs are important measurements that help us get a better understanding of how the body is functioning. Blood pressure tells us how well the heart is pumping blood and pressure in the arteries. Pulse rate tells us how fast the heart is beating, indicating how well the heart is working. Respiratory rate shows us how many breaths a person takes per minute, helping us understand how well the person is oxygenating. Temperature gives us any indication on whether or not there's an infection or inflammation going on in the body. All of these help us detect any potential issues to help guide further assessment and treatment. So before we begin with our assessment, it is very important to sterilize and clean the equipment you plan to use. Right here, I am using an alcohol wipe to wipe down my equipment. Now we must conduct hand hygiene. Right here, I am using hand sanitizer. You can also wash your hands with soap and water, but I figured it would be better to just use hand sanitizer in this situation. And now I am applying my gloves. You also have to make sure that the patient doesn't have any latex allergies, so it's always best to use latex-free gloves. Also, it's very important to make sure that you're wearing gloves that fit you properly. So we're going in with the pulse rate. Now for her pulse rate, I decided to use her radial pulse. You count the number of beats you feel for 15 seconds, and you times that number by 4. And whatever the answer is that patient's pulse rate. So now we go in listening to the heart with our stethoscope. When you're dealing with a pediatric patient like I am, it's very important to make sure that they stay still. Moving can kind of throw you off. Now we go into blood pressure. Before doing blood pressure, make sure the patient's legs are uncrossed. This is how the patient's legs should look before you do blood pressure. When doing your blood pressure, you want to line the brachial artery line with the brachial artery, and you also want to make sure that the cuff fits properly. If it's too big, it can read as low blood pressure. If it's too small, it can read as a high blood pressure. What I like to do is ask the patient what their blood pressure normally is, so I know what range to listen out for. For example, if they say their blood pressure is normally 120/80, I will make sure not to pump the cuff up past 160 because I don't want to hurt the patient. Now you want to make sure that the knob is turned tightly, so when you puff the cuff up, no air comes out. Here I am pumping the cuff up all the way so I can get to the systolic number. Now you turn the knob to release all the air, but make sure to go slow so you listen out for the systolic number. And then the last number you will hear out is the dystolic number. Next, we check the temperature. I asked my patient to lift up her tongue, and I placed the thermometer under her tongue to get an accurate temperature. Another way to get an accurate thermometer reading is through the rectum, but we will definitely not be doing that today. If you're interested or curious, look on YouTube. Now, lastly, we want to check the respiratory rate. Now, how this is done is you watch the chest rise and fall to equal 1 breath, and you watch it for 15 seconds and times that number by 4 to get your respiratory rate. Typically, you want to do this in a way the patient is not aware, but for training purposes, the patient will be aware.
This is Gabby, and she is going to tell you about lung assessment.
Hold on. Okay, much better.
This is Gabby's boyfriend, and he was definitely not forced to do this.
I was not forced to do this. Is this your role?
No, this is patient 1A cover-up. Enough of that, back to the lesson. When doing the lung assessment, the first...
Thanks, AI, but I got it from here.
Oh, okay.
When doing a lung assessment, the first step is inspection. This helps the therapist gather important visual clues about a patient's respiratory status. Observe the overall appearance of the patient. Is the patient calm, anxious, or in any visible distress? You can also observe the patient breathing pattern by watching the movement of the chest. In babies, you can look for nasal flaring, which is a sign of discomfort. Assessing the patient's skin color and posture show signals of respiratory difficulty as well. Now let's talk about auscultation. But remember, before touching any patient, make sure that you are following standard precaution by wearing gloves. Auscultation is a key part of a lung assessment. It's when a respiratory therapist listens to the patient breath sounds using a stethoscope. It helps identify conditions like wheezing, crackles, bronchi, or the absence of breath sounds. To do this, warm the stethoscope with your hand and place it directly on the patient's skin and listen to systematic patterns, comparing sounds from side to side. Ask the patient to breathe in and out through their mouth a little deeper than normal. Palpation is the process of using the hands to examine the chest walls for information that can't be obtained by inspection alone. The respiratory therapist is feeling to see if it is symmetry of the chest expansion by placing hands on both sides of the chest and watching how they move as the patient breathes in. Unequal movement may indicate that there is some problem. When doing palpations, sometimes the therapist or physician may ask you to say something such as 99 or Kentucky. When they are doing this, they are feeling for vibrations. Last but not least, percussion. Chest percussion is tapping the chest to identify underlying lung tissue characteristics by listening for sounds like resonance, dullness, or hyperresonance. To perform it, place your non-dominant middle finger on the patient's skin and then tap the distal joint of that finger with the dominant middle finger. Thanks for watching our presentation. I hope you learned something.